Recording stop.
Can. I'd like you to really stand if you can, and I'd like you to engage with a little bit of movement with me, actually. So I'm going to stand up, and it's really very, very simple. If you want to do it sitting down, you can do most of these sitting down, but I really always like to start my presentations with a little bit of movement. Most of you have probably had at least breakfast, and some of you have probably had breakfast and have had lunch. So it's really very easy. Okay. You don't have to be coordinated. You don't have to be an athlete. These are simple movements that you could do at any time. So we're going to put our hands on our waist and we're just going to do a little bit of head turns. So we're going to turn our heads to one side and we're really going to try to stretch, especially around the neck area. And then we're going to turn it back to the other side and we're going to stretch that side as well. And we're going to do one more on the first side that we started on. And then we're going to do a last one on the side that is the opposite of the first side we started with. I know I'm confusing everyone now. Okay, so that's the first thing we're going to do. Now we're just going to put our hands in front of us. Okay, and we're going to put them above our head and we're going to try and really do as much stretching as possible. And then we're going to try to turn to one side and really stretch, and then turn to the other side and try to get as much of a stretch as you can. Again, to the first side. Everyone's doing fantastically. I know not everyone has their camera on, but I'm sure you're looking fabulous. And then one last time here. All right, fantastic. Now we're going to get our hands back on our waist, which is kind of our starting point for all of these. And we're going to pretend that we are outside and we are playing hula hoops. I think most of us are old enough to remember the hula hoops. So what we're going to do is we're going to do some hip rolls. And you can go any way that you want. So we're just going to turn our hips around, just going to go in little circles like we have a hula hoop. We're going to go one way, okay, and then we're going to go the other way. All right, fantastic. I hope everyone is able to do this. And if you can't, just do what you can. You can shift back and forth if you need to, but you're doing great. And now that you've done that, we're going to do some shoulder rolls. So you're going to roll your shoulders forward first. Okay, wonderful. And kind of relax those shoulders, get them ready so that you can really absorb all the information that you're going to be receiving this afternoon. And then go backwards, do them backwards. Okay, and it really feels good. It gets the blood flowing. It, really relaxes us and it clears the mind. All right, fantastic. And now we're going to go ahead and we're going to do some leg lifts. So just lifting your leg, your right leg first, and just lift 4 times. And then go to the other side and do 4 times. If you do need the assistance of just holding onto a chair or something, that's fantastic. You can go ahead and do that. Now we're just going to march in place. So we're going to march in place. Okay, and again, lift your legs as high as you can. And now we're going to put in the arms. Okay, let's put in those arms and really get that blood flowing and bring those blood sugars down, because if you've eaten, your blood sugars are high. I know mine are. Okay, fantastic. All right, very good. So the next thing we're going to do is a little bit more complicated. We're almost at the end, but I want you to cup your hands in front of you and I want you to do just a few squats, not a whole lot. You're going to keep your legs a little separated. And if you need again to hold onto a chair for some support, that's fine too. And we're just going to go down as far as you can and then up. And we're going to go down again and then up again. And then one more time and then up again. Fantastic. And now we're going to shake those sillies out. Just shake your legs and your arms, everything. And now I want you to take a deep breath in and I want you to let it out. Now I want you to close your eyes and I want you to take a deep breath through your nose, nice and slow. 1, 2, 3, 4. And then let it out through your mouth. 1, 2, 3, 4. And then in again through your nose. 1, 2, 3, 4. And then out through your mouth. One, two, three, four. Fantastic. All right. Give yourself a big hand and applause. You did fantastically. Okay. So that's something that is really important, especially after meals. If you can get in, even 5 minutes is better than no minutes. It's really good for all of the systems and your overall well-being. So I'm Dr. Marisol, owner, founder, chief executive officers of Wellbetic. Wellbetic is a dream of mine. I am originally by trade a nurse practitioner. I have numerous degrees, but this in particular, being nationally certified as a diabetes education, as a nationally certified diabetes care and education specialist, is one of the things that I've used for about 20 years in my education journey. And I am what's called the expert in education that has to do with anything to do with high blood sugars. So prediabetes, diabetes, diabetes in pregnancy, high blood sugars, insulin resistance. I'm the one that clients are sent to. And this is a dream of mine. Well for well-being and excuse me, well for well-being and for wellness. And the Bedic is for prediabetes, diabetes. And as you can see, the B and the L, they're hugging each other. And the I is a little stick figure, which really symbolizes us. And I have the infinity sign because once you're diagnosed with prediabetes or diabetes, you pretty much have it as part of who you are. And it does change over time, but it is a lifelong disease or condition. Okay. And so what you're going to get over the next hour and a half or 2 hours that we have is you're going to get a foundational understanding for a more empowered journey about prediabetes and diabetes. Hopefully everyone's got some water on hand because I like to drink as well as I talk, and hydration is also really important. So we're going to start with learning the difference between prediabetes and diabetes, because these are two terms that are always being thrown at clients and at people in general. What is prediabetes? What is diabetes? And it really boils down to numbers. And so normal blood sugars, fasting blood sugars, if you go to your medical provider and you get a fasting blood sugar done, your normal should be basically between 70 and 99. If you go and your fasting blood sugar is 100 or above, then you will be in that pre-diabetes phase. And then diabetes, of course, is if you're 126 or higher. Okay. And so what does that all mean? So what it means is that we all have high blood sugars. When we eat, our blood sugar automatically goes up. Whether you've been diagnosed with prediabetes, you have normal blood sugars, or you have diabetes. However, when you start getting into that prediabetes stage, that is when your blood sugars are staying a little higher than normal, but not high enough for you to be diagnosed with diabetes. But the risk is what we're concerned about. Developing type 2 diabetes becomes a higher risk in individuals that have been diagnosed with prediabetes. And so it puts them at risk not only for type 2 diabetes, but heart disease and stroke. So being told that you have prediabetes is really sort of an important piece for everyone, because if someone says to you, your blood sugar is a little high, then you want them to really tell you what exactly does that mean? Does that mean that I have prediabetes? Because if you have prediabetes, then this is the time to take action. And that's really important to hopefully delay or not have it become and develop type 2 diabetes. Let's take a look at the definition for diabetes mellitus. And I've made it as simple as I possibly can because it can get quite complicated. And remember that everyone who has any type of condition, it's really unique to you as a person, because there are a lot of other factors that impact our health and impact prediabetes and diabetes. So diabetes is a condition that occurs because our blood sugars are too high. And why are our blood sugars too high? Well, because we have a little organ called the pancreas, which sits pretty much behind the stomach, and it doesn't produce enough insulin, or is not producing any insulin at all. And that insulin is really important because insulin is a hormone that acts as a transporter so that it brings the blood sugar in the bloodstream into the cells for energy. And we need energy because that's how we stay active. That's how we're able to do the routine that we just did for a few minutes earlier before the presentation. That's how we're able to function at work. That's how we're able to drive and do all the things that we love to do with our families and friends. There are a number of common types of diabetes. I'm only going to talk about a few, but trust me, we are finding new forms of diabetes all the time. So these are the ones that most people are familiar with. Okay. The first one is type 1 diabetes. You may remember type 1 diabetes as juvenile diabetes. And it used to be that this was only something that we saw in children or in toddlers. Okay. And what's happened is that is changing. Okay. We are now seeing adults, young adults, middle-aged adults, older adults, all developing type 1 diabetes as well. This is an autoimmune disorder, which means that these individuals really are not making much insulin at all. And what's happening here is that the body is actually attacking their own body, is actually attacking their beta cells in the pancreas, which are the cells that produce the insulin. Type 2 diabetes is the more common type of diabetes that most of us are very familiar with, and it is often lifestyle related. It has to do with having higher blood sugars and having insulin resistance and perhaps not taking very good care of ourselves, or perhaps being on a medication that was necessary for another condition, or perhaps having some type of severe trauma to the body that resulted in type 2 diabetes developing. We have gestational diabetes for women that happens during pregnancy. And we also have diabetes that occurs because of medications. There are medications that we're on for a number of things, high blood pressure, high cholesterol, that do increase your blood sugars. And so we have to weigh benefits, okay, versus the risk. And we have to figure out, do I need this medication or is this something that I can handle through lifestyle balance and changes? Okay. And of course, what do they all share? Too much sugar in the bloodstream can cause serious health problems. So anytime you're diagnosed with diabetes, it is important for us to take action and to educate ourselves so that we know exactly what our risks are and what we can do to minimize that risk. With type 2 diabetes, we have a number of things called risk factors that can also be part of the reason we develop diabetes. And these are just a few of them. This isn't all the risk factors because everyone's factors are different. What's a risk factor for someone may not be necessarily a risk factor for another person. But I will share that I've been in diabetes education for over 20 years. And when I started, there were only 8 million people that had diabetes. Okay, that number has changed drastically. And the age that was a risk factor was 45. Today, that age is 35. So it's 10 years, 10-year difference. People are getting diabetes, whether it's type 1 or type 2, at a much younger age. Ethnicity can play a role in terms of a risk factor. Obviously, if you are Asian American, if you are African American, if you're Latino American, those cultures tend to have a higher incidence of diabetes, particularly type 2. If you're living with a little extra weight, if your lifestyle is sedentary, if you're not moving, if you're always sitting, if you don't get outside, if your job requires you to be in front of a computer, if you're a big, video game person who is always actively in front of the screen, those are risk factors. Family history is also a risk factor. If you have individuals in the family, like parents or grandparents, or even aunts and uncles, that can be a risk factor for you. If you are a woman and you did have a diagnosis of gestational diabetes, that becomes a risk factor for you in terms of type 2, developing type 2 in the future. Medications that I already mentioned can also be a risk factor for many people. Smoking can be a risk factor for many people. And I put polycystic ovary syndrome because that isn't one that's fairly common, but it is also a risk factor in developing type 1 or type 2 diabetes. And what are the symptoms that we're concerned about if we think we might have prediabetes or diabetes? So everyone's symptoms is also different because, again, I want to really emphasize that this is unique to the individual. Everyone's symptoms are different. What is a symptom for you may not necessarily be a symptom for someone else. So that's why it's even more important that we really take a look at what's happening to us and pay close attention to our bodies. Severe thirst, frequent urination, increased hunger, those are the three most common ones, and those are the classic symptoms of diabetes development. But some people will complain of blurred vision, they'll complain of severe fatigue, they'll complain of slow healing cuts, they'll complain of, infections. All of a sudden they've developed an infection and they didn't realize that they had it. Okay, so there are different symptoms for different individuals. Pay close attention to what you're used to in terms of your body and know the difference. So why should we learn about prediabetes and diabetes? And why is this a vision for me? And why do I think that increasing awareness of how important diabetes education is for us as individuals, as a society, globally, worldwide? These are the numbers. As I mentioned earlier, when I started over 20 years ago as a diabetes educator, there were 8 million people with diabetes. Today, there are 38.4 million people of all ages in the US that have diabetes. That's 11.6% of the population. And as you can see, look at the difference between those that are diagnosed, and there's still 8.7 million that are out there undiagnosed. Here's another statistic for you. Estimated 97.6 million people 18 and over have pre-diabetes already. Okay, that's an enormous number. And new cases of diabetes, right now we're seeing 1.2 million Americans being diagnosed with diabetes every year. And these statistics are from 2021, by the way, from the Centers of Disease Control and Prevention. And this statistic is for gestational diabetes. Those women that have had gestational diabetes in any of their pregnancies have a risk as high as 8.3% of developing type 2 diabetes within 5 years of giving birth. Some sooner, some later, but the risk is there. So you want to minimize that risk. You want to know what your risk factors are. You want to know that this is an epidemic, and you want to try and do what you can to make sure that you don't become one of the statistics. Or if you do, it's when you're 100, and we all are going to have something when we're 100, right? Now, just to share a little bit of information additionally to the statistics, in July of this year, the Centers for Disease Control and Prevention also put out a study where one in three teens and preteens between the ages of 12 and 17 already have prediabetes. That's huge. And even more daunting is that by 2050, this is what we're looking at. Worldwide, we are looking at a projection that 1.3 billion people will have diabetes. And they're saying it's due mainly to global aging and rising weight. But I also believe that the digitalization of society and the lack of activity and the lack of eating at home all contribute to the same category. So what can I do to lower my risk? Identify what your risk factors are And the first thing is education. Cannot stress it enough. Education, education, education. When we are told that we have some condition, it is important that we get education on how to best manage and live with that condition. And it's no different for prediabetes and diabetes. But in fact, it is probably the most important piece because with education, you learn to eat healthier. You learn about movement and the importance of physical activity. You learn about stress management. You learn about keeping yourself in a healthy weight. You learn about improving your blood pressure, your cholesterol levels. You learn about really taking care of your entire body. And we also encourage you to be a strong advocate for yourself, to stay curious, to stay informed, and to ask questions. Many of us were brought up, I don't know about you, but in my culture, I was brought up that there was an utmost respect for the medical provider, and whatever the medical provider said and did and asked you to do, we did. But now we realize that you want to be able to have a medical provider or even an educator that really works with you and hears you, sees you, listens to you, and is willing to work with you because it's no longer here, take this, here, take that, here, add this to what you're already taking. It's about what can I do for myself that's going to help my health and improve everything that I'm living with. So, what are the next steps? You have to prioritize your health. You have to start living your best life ever, which I tell clients every single day. So important. You got to bring more happiness into your life. You've got to be more focused on the present versus staying in the past or worrying about the future. You've got to sleep more. You've got to choose education. You can choose Wellbetic if you wish, and you can choose yourself because we are, our best advocate. We need to live our best life ever through just taking good care of ourselves so that we can then move on to take care of those that need us. Okay, that is the piece that I'm providing for you. Now, please let me hear from you and let's get some questions. Those of you that are comfortable, why don't you share some of your thoughts and experiences? Ask me questions and let's go from there.
I gotta first unmute everybody. So let's see. It just says mute all. Let's see. How do you unmute everybody?
Well, if they have a question, they can unmute themselves. Maybe they raise their hand.
Okay.
Mhm.
Nobody has any questions?
Uh,
Okay, Marty has a question.
Hi.
Hi.
Um, I have a question. If look at the internet like most people do, you scroll and look at different things. I've noticed that there's a lot of stuff on there about diabetes, but you don't know whether it's true or not because
Correct.
they say and to make it worse, they have celebrities that are on there and they endorse these um, supplements for people to take that they claim eradicates diabetes.
Hmm.
Now, none of this is FDA approved or anything else like that, but they get away with advertising this stuff. And I just wanted your thoughts on that and if anybody is fighting back about that to make sure what we see is true or what.
That's a great question, Marty. So for me, I feel that the body heals itself if we just give it time, if we just do the things that are simple, okay? Like trying to eat as healthy as we can, trying to make sure we are hydrating well, trying to uh, get movement into our lives, making sure we minimize our stress level, making sure that we really bring in those people that make you feel like sunshine all the time. There are things that we can do for ourselves that are going to pretty much equal what some of these drugs do. It's just that we live in a society where gratification, instant gratification, is very, very important to individuals. And yes, I agree with you. There are a lot of celebrities out there that disappoint me when they take on the responsibility of knowing that their actions and what they say becomes true to most of the population. And they are really increasing the money flow that goes to this pharmaceutical huge industry that keeps putting individuals on more and more and more medications. Yes, if the medication is important and you need it, then I say, yes, it's important that you take it. But a lot of these medications are super expensive. And, I'm a tennis player. And one of the individuals that has really disappointed me is that Serena Williams, who's a US tennis player, one of the best, is going out there and really advocating for GLP-1s. Now, she has the world at her feet. She could have the best trainers, she could have a chef, she could do this all naturally without the side effects of having to inject herself once a week. But her preference, and this is her choice, is to take an injection once a week so that she can take off those 31 pounds immediately. Okay. And we can all take off 31 pounds if it's what we need to do, but it can be done in a healthy way with modifications, with some lifestyle balances, with the right education, with the right connections. These are all things that you can achieve. All you have to do, the GLP-1s are great, but they're full of side effects. And we don't know long term what these side effects are going to be. There's now a new study that's showing that there's some bone formation and density issues that are happening for women that have been on GLP-1s for a long time. There are providers out there that are saying to individuals, hey, you'll have to be on a GLP-1 for the rest of your lives. Well, none of that is true. You do not have to be on any medication for the rest of your life unless the benefit really outweighs the risk. The GLP-1 is something that you can mimic by just slowing down how long you take to eat. You're not inhaling your food from one corner of your drive to another. So you slow down how you eat. You make sure you're sitting for that 30 minutes. Make sure that you chew slowly. Make sure that you really enjoy your food. Then have a little activity after you've eaten. Hydration is important. And really, you can achieve pretty much the same results. Yes, they're not going to happen in 48 weeks, in 48 hours, but they will happen. It will happen. Healthy weight loss should not be more than a half a pound to a pound a week. That's healthy. Does that answer your question? Does that make sense?
Partly that's the medication, the GLP-1. But I
Yes.
think what I was talking about was more the supplements that are out there that they have these claims of eradicating diabetes just by taking this pill. If you take it for 30 days or 90 days, it's like a miracle pill. And of
Oh,
course,
okay.
and
Mhm.
my philosophy about stuff like that is if it sounds too good to be true, it is too
Mhm.
good to be true. But
Right.
I just wanted your thought
Yeah.
on that.
So, yes. So, in terms of supplements, again, you got to be careful. You got to be careful of taking a supplement without doing your research. I've had clients come in who have sworn by a juice that they've been taking because, a family member brought it from their country and they've been taking it and taking it and taking it and really not looking at what's in it. What are these things that are in it? What do they contribute to? Do they increase blood sugars? Do they increase blood pressure? What happens? And a lot of them come in through the emergency room because either their blood sugar has gone sky high or their blood pressure has gone sky high. So in terms of supplements, I think unless you and your medical provider have sat down and have decided that this supplement would be a good thing for you, like for example, vitamin B12, then you decide, is it something that I want to do, or is it something that I actually want to get out of the foods that I'm eating? Can I get from the foods that I'm eating enough vitamin B12? Um, I'll give you a personal example. I had some blood work. My vitamin B12 level was normal, but my provider wanted it to be a little higher than it was indicating, even though it was in the norm. And so I researched it. I said, let me eat more of the foods that are, have more vitamin B12. But he really strongly encouraged the vitamin, and I did. And then I made sure that he did blood work to evaluate the level of this particular supplement
Mhm.
because I want to make sure that nothing is off balance. Sure enough, when he did the blood work, because I was also eating foods that were high in vitamin B12, okay, my B12 level went from normal to like 3 times what I had. Okay, so immediately I had a conversation with them about, I'm not taking this anymore. Let's see how, it goes for the next 3 months, and let's do more blood work because I want to make sure that this is back to more of a normal result. And a lot of times what you get, and I've been with my medical provider for quite a number of years, but I advocate for myself and I don't want to be on anything that's excessive. Um, so in about 3 or 4 months, we repeated them the blood work again, and it came back to more normal levels, more normal levels, because it was already normal to begin with. So just things like that. That would be my recommendation. I don't feel that we have to supplement anything if we are really focusing on healthy eating, healthy lifestyle, and good balance.
Okay.
Okay, Karen has her hand raised. You can unmute. Yeah.
Yep,
Hi,
I'm
Karen.
unmuted. Um,
Hi, Karen.
Hi. What are your feelings about labeling on our food that we buy in the market? And what are the accuracy of what they're telling us about how much sugar there's in any particular product?
Okay. So most of the labels on the foods that we purchase should be pretty accurate. Okay. They really do a very good job. It's really learning how to read the label that's more of the issue. You have to understand what you're reading and what it means and what it translates into, and you have to know that what you're interpreting is correct. Because, for example, when it comes to diabetes or high blood sugars, okay, people will say to me, well, I don't eat this because it has a lot of sugar. Or I don't eat this because, or I eat this because it doesn't have a lot of sugar. But sugar is the same thing as carbohydrate. So if we look at a label, okay, an actual label on any type of product, you will see that it says total carbohydrate. And then underneath, it'll have fiber, it'll have total added sugars, et cetera, et cetera. Okay, well, you're not worried about that other stuff. You're only worried about the total carbohydrate because the total carbohydrate is what we are really paying attention to when we're living with prediabetes or diabetes. So
Okay.
that's what I would focus on. And fiber. Even though fiber is a carbohydrate, it's absorbed by the body differently and slower. Your typical carbohydrate, like white bread, white rice, your sweets, okay, your pasta, your potatoes, your white potatoes, okay, they're all absorbed quickly and they turn into sugar within 15 to 20 minutes of you having them. Okay, so you want to slow that down, and having more fiber in your meals is definitely a wonderful benefit.
Yeah. Thank you.
Mhm.
Okay, Bob has his hand up. Bob
Great.
Feller.
Okay,
So excited.
Larissa, what's your observation on?
Hi, Bob.
Okay, hey, how are you?
Good, how are you?
Good. What is your observation on how much the fast food restaurants such as McDonald's, Burger King, etc., have contributed to the increase in the rise of diabetes?
So, so I think anything and everything can contribute to the rise of it. It's all dependent on what are we choosing. Okay. I don't tell my clients that they have to stop eating things that they love. we try to figure out what do they love and how can we incorporate what they love into their meal planning. Okay. I am not going to recommend that a client eat McDonald's for all 3 meals a day. Okay. But if they need to have, once in a while something, then we try to use an app. There are a lot of apps out there that actually give you the total carbs that are in those different foods that we're choosing. But what contributes to the rise in prediabetes and diabetes, in my observation, in my opinion, is the choices that we are making for ourselves and for our families. Okay. Because everybody's out there to make a buck, and everybody's out there to inundate you with all of these wonderful commercials and all these wonderful actors that are out there trying to sell a product. But it's up to you to decide, does this work for me? Does this fit in what I'm doing? But to answer your question, for me, it's really the choices that either parents are making for their children or we are making for ourselves that is increasing the rise of prediabetes and diabetes.
Thank you.
Does that make sense?
Yes, it does. Thank you.
Yeah. It's hard. Temptation is everywhere, right? We go to all kinds of things. Kiddush, for example. Okay. Well, originally we were going to have this at the synagogue, right? And I had requested that there be healthy snacks. So that means no cookies, no brownies. Okay. We want fruit. All right. We want granola bars. We want, things, nuts, if there are no nuts, nut allergies, but things that are really going to benefit us and our blood sugars.
Okay, Elaine is next. Elaine Cohen. Wait, Elaine, you have to unmute yourself.
Hi, Elaine.
How's that?
Perfect.
Okay. What foods are high in vitamin B12?
Oh, that is a great question. Green
Me.
leafy vegetables are
So
hot.
like spinach,
Yeah,
right?
yeah, spinach, kale. Um, what else did I eat when I was going through that? Any of the vegetables, a lot of them, especially the green vegetables, the broccoli,
Broccoli,
the Brussels sprouts, that kind of thing. I don't know who Lynn is, but she's helping me. Thank you. But those kinds of things, yes.
Red meat?
So red meat is more iron, and not so much B12 that I'm aware of. And you
What's
want
red
to
meat too?
consume it in smaller amounts. So it's more of an iron thing for red meats.
I
Yeah.
always connected vitamin B12 with the iron bit.
Mm-hmm.
Is that wrong?
Um,
You could
that's
say
a
yes.
good
All right,
question.
won't be
That is a great question, Elaine. I'm not sure. I don't really associate that combination, but I'll look it up and get back to you on that specifically if you want. The B12 and the red meat is what you're saying.
It seems to me I used to give injections of B12 to people who were anemic.
Uh-huh.
And then they said, eat red meat.
Hmm.
So
Now, that's
that
a
makes,
long time ago.
yeah, yeah. So I think what it is, I think it's that the vitamin B12 impacts the iron level.
Yeah,
Mhm.
That's what I think is happening there. Yeah, yeah. And so that's why the folks need to have a little bit more iron in their system.
Yeah,
I wouldn't necessarily say eat more red meat, though. There are a lot of other things that
I
can
know.
contribute to iron that are a little healthier for you.
Yeah,
Yeah,
but they don't taste as good.
yeah, true.
but I
So,
thought
so we
I
choose them maybe just once in a while.
I thought what is the thoughts about now? I have a question about the red meat. Like I thought you're not supposed to eat too much red meat. Like it keeps going back and forth. Like before they used to say don't eat the sugar substitute. Now they say, yeah, you can eat it.
Yeah. Yeah. I mean, really, I tell clients you can eat anything you want to eat. It's just how much are you having? Okay.
Moderation.
Right, right. If you know that you particularly are at risk for certain, if you know what your history is, for example,
Yeah.
I have a strong family history of diabetes because I am from a Hispanic background, right? My parents are from Puerto Rico. My grandparents, I had a grandfather who had type 1. I had a father who had type 2. So in my 20s, I loved coconut cake. And every day I had a very big piece of coconut cake beyond what we should be having. Trust me. As soon as my dad got diagnosed with diabetes, I stopped
Stopped
eating.
eating coconut cake.
Correct. Correct. I have it once a year, typically on my birthday. But my two sisters did not make that same choice. Okay. We all talked about it. We're like, grandpa had type 1. Now we have dad that has type 2. We really need to look at ourselves because we are looking at a future of potential diabetes.
Mhm.
Okay. And I made and then it became a lifelong uh,
Really?
professional piece for me, in particular. But yeah, I gave that up cold turkey. I used to squeeze that coconut cake even if I had a full lunch or not. It was awful. I was overeating all the time,
Mm.
all the time. I didn't always look like this.
Yes.
I've always been a small person, but I probably had a good 20 pounds extra.
Now I have a question. What happens if you like have diabetes, but it's not a family thing? Like you don't have it in the family.
So that's a great question. Many people can get diabetes without having a family history. Their risk factors might be different. So, risk factor for them might be a medication that they're on, for example. Or another risk factor, I had a client a few months ago that had open heart surgery that was sort of an emergency open heart surgery in March. And that individual's blood sugars from the stress on the body increased her blood sugars enough to put her over the top in terms of her blood work results. And she was diagnosed with diabetes.
Mm. Mm.
So there are other risk
Yeah.
factors that apply to different individuals. And remember that also things have really changed. Over the last 5 to 8 years, there's been a lot of technology that has grown in the field of endocrinology, which is the field that incorporates diabetes and all of the other endocrine problems, including
Mhm.
thyroid and others. So you have to remember that beforehand, we may not have had the same information. We may not have had the same access.
Mm.
People, things are changing, like you said. So, you look in the news, they tell you this is good for you. No, no, now it's not good for you. Now this is good for you. You decide what's good for you because you know what you love. What is it? I ask my clients, what do you love? I have a client who says, I don't eat vegetables. Okay.
Mhm.
Tell me what a vegetable is. Because a lot of times they don't even know that they're eating vegetables, but they don't
Yeah.
like vegetables. Okay. Sometimes they will only eat certain things. Okay, so you'll only eat certain things. Let's go with that. Okay. I want people to live happier and healthier. I don't want people to live miserable and
Mhm.
upset because blood sugars that go up and down also impact our mood. So you could very well end up with being a little short fused or being fatigued or as a result of not having enough of the foods that you really need to eat. I'm sorry, I'm just going to take this off because it's really squeezing my head a little bit. Does that make sense? Do you have other questions that I can
So what
answer for
kind?
you?
I have a question. What kind
Yeah.
of drug? What kind of drugs could impact you getting diabetes?
So there are some medications that you take for blood pressure, for example, that can increase your blood sugar. There are medications that people take for cholesterol that can increase their blood sugar.
Mm.
There are people, 1 out of 5 individuals that has a cancer diagnosis is
Mhm.
at risk for diabetes because of the chemotherapy that is given and the steroids that are sometimes given when
Mhm.
someone's going through
Mhm.
treatment for cancer.
Mhm.
There are pulmonary conditions where people have to be on certain specific medications that can also increase your blood sugars.
Broccoli.
So it doesn't automatically translate into
Mm.
I'm taking this medication. I'm taking Lipitor, for example, for cholesterol,
Mm-hmm.
and I'm going to get diabetes. It's just you,
Mm-hmm.
it's just being informed. It's just you being an
Mm-hmm.
advocate for yourself. What does this medication do to the other parts of my
Yeah.
body? And what can I do to then mitigate that if, in fact,
Mm.
I could be at risk
Mm-hmm.
for increased blood sugars?
Mm-hmm.
And what are my other risks? Is that medication my only risk? Is taking that medication my only risk to having high blood sugars? Or do I also, am I over 35? Do I have a family history of diabetes? Do I have a sedentary lifestyle? Do
Mm-hmm.
I have a history of gestational diabetes? You start to look at what are my risk factors. And if you have quite a few risk factors, then you know that you have to do a little bit of work. And again, education is
Mm.
in
Yeah. Is that why a lot of doctors like they outweigh the risks versus like what's the benefit?
correct,
Right.
correct, correct. But it's also up to you and how you're feeling. I see a lot of clients that put up with medications that are giving them horrible side effects. And every
Yeah.
medication you take, whether it's over the counter or prescribed, is
Mhm.
going to give you a side effect.
Mm-hmm.
So I want you to understand that you have to decide for yourself if this medication, if there are other medications that I can take for this, and this medication is really bothering me and giving
Mm-hmm.
me horrible side effects where I cannot have a good quality of life, then please let's take a look at something else that I can use.
Mm-hmm.
You are living with the condition. You are the one taking the medication. So
Yeah.
you are your own expert.
Yeah. But I find sometimes, like, I know with my doctor, like, even when, like, they found out, like, my sugars were kind of weird, like, immediately she was like, here's your metformin, go home, bye. Like, she didn't
Oh,
even, like, talk about, like, she didn't even, like, she's like, here, this is what you're going to do. Like, they didn't even, like, I don't know. I feel sometimes they, like, pressure you into doing this stuff.
well, that's when you have to take a stand for yourself. I'll share a little story about metformin. I had a client that came in. She had been on metformin for 3 years. She was wearing, what do they call them? The pads. She was
Yep.
wearing pads.
Mm-hmm.
She would come in, not looking well, because the metformin had given her some very bad gastrointestinal side effects, but she did not say anything to her provider. And because every time she had tried to talk to them, they would say, you need to stay on this medication, you need to stay on this medication, you need to stay on this medication. And so, as an advocate, because I'm a diabetes education specialist, and an advocate for my clients, I said, oh no, you are not staying on this medication because it's ruining your life. There are so many other medications that you could be taking that can do the same thing. So I immediately messaged the provider, had a conversation with the provider, and eventually we cut back on the dose. Didn't matter. She was still having the same side effects. We tried to change it up. How are you taking it before meals, after meals, in the middle of the meal? Different things like that, that you can really sort of start to get the picture of what is happening. And eventually we did take her off the medication and put her on two other medications, which resulted in the same impact, if not better blood sugars for her. But she was a changed person. She looked phenomenal 6 months later when she came back to see me. So yeah. You have medical providers that are going to say to you, I need you to take this, but ask questions.
Yeah. Because I
Are
feel
there
like,
other options? Why do I have to take it? And then if your medications are giving you side effects, talk about other options. And in
yeah.
the end, if someone is not listening to me, it's time for me to get a different provider.
Yeah.
Right.
Yeah.
Okay, I'm gonna cut in and say, Lynn, maybe you could have a sidebar conversation with Marisol, or
Yeah.
Marisol, you can, I'm letting you promote your business. So if you want to go to that slide where it has your maybe your telephone or your personal information. So here you go.
Yeah.
Yeah.
So
Yeah.
people who are interested, they can contact Marisol.
Yep,
She's
except
willing.
that I just realized that our phone number is wrong.
Oh,
So I apologize. The phone number, for those of you that want to write it down, is up 860-689-1234. I actually have a holiday special. I'll send this over to Audrey to send to all of you. This is a time where we are doing a lot of giving. It's Hanukkah starting tomorrow, and it's always nice to be able to give someone a gift. So why not give them a gift of education if it's someone that's living with prediabetes or someone that's living with diabetes, or perhaps a daughter or a niece or yourself if you're thinking of a pregnancy in the future and you just want to make sure that your blood sugars are where they need to be before you start that path. So I'll send that to Audrey, and please feel free to call me and we can schedule something.
What's that number again? 678?
It's 689-1234.
1, 2, 3,
My
4.
apologies. I should have updated this and I didn't. So
Marty just wanted to know if is your services covered by
Yeah.
insurance?
no, my services are not covered by insurance. Right
Okay.
now, my services are holistic, so they are looking at the entire person. I'm interested in what's really happening with you versus just your numbers and your blood sugar and what medicine you next need. I'm interested in helping you live your best life ever without with as with the least amount of added medications and changes.
And what are the fees if you know?
You'll see it on the flyer. They're actually very reasonable, very reasonable. And the holiday discounts are really great.
That's what she said.
Okay, there's one
Yeah.
more question. I think it's I'm sorry, I don't know your name. The woman that raised her hand to
Karen,
you. Yes,
Hello,
you're unmuted.
Kara.
Did you want a question?
I should get rid of her picture.
I guess not. Okay. All
I
right.
have a question.
Okay.
My name is Evelyn.
Hi,
I'd like,
Evelyn.
I'd like to find out what your feelings are. I know, like with I'm a diabetic too,
Okay.
that I pinch my fingers every day. And now the doctor put me on that Libra 3
Okay.
plus.
Yeah.
What are your feelings about that? Because I notice when I do that, I get one number, and when I prick my finger, I get another number.
Yes. And that's going to happen. So first of all, my feeling about that's called CGM technology or continuous glucose monitoring technology, and that is a godsend. It is amazing technology, okay? But it's not perfect. So keep that in mind. Once again, try not to get too dependent on something because it's not 100%. Remember that that little sensor, that Libre 3 is super tiny, right, Evelyn?
Right.
You can barely feel it and even see it. And so actually, you know what? I think I have, Nick, would you pass that over to me? Thank you.
I told you.
Okay. So these are some of the sensors. I know that Evelyn's on the phone, so she probably can't see this, but this is the
Right.
Libre 3. It's a little tiny thing.
Can you move it? Yeah, okay, yeah.
Can you see it?
Yeah.
And so these are opportunities for individuals to really get a sense of what's happening to their blood sugars on a regular basis. This Libre 3 monitors your blood sugar every minute, but it is underneath the skin. It's in the interstitial fluid. So what does that mean? That means that it's not in the bloodstream. And the bloodstream blood sugar is much more precise. So that is why, Evelyn, when you do a finger stick, your number is different from when you look at your sensor.
So you're
Does that
better
make
off.
sense?
It does. So you're better off doing the finger stick
Well,
than
not
having.
necessarily, not necessarily. Okay. If your blood sugars are still in the range that you and your medical provider have decided is a good range for you. For example, in general, most individuals, okay, we want them to be 80 to 130 before they eat. And then 2 hours after they eat, we want them to be 180 or below. However, that can change based on other conditions that you might have. So those targets can be different for everyone, but in general, those are the targets. So if your sensor is staying within those target ranges before meals and 2 hours after meals, I wouldn't change a thing. But
I says,
if it alarms that you're low or it alarms that you're too high, then do a finger stick to make sure because this level is always going to lag behind. It's going to be like 20 minutes behind the level that you get from your finger stick.
I see.
Does that make sense?
And
It does.
why 20 minutes?
That's just in general because of the fact that it's in the interstitial fluid. So by the time, like if someone has a low blood sugar, for example, if the alarm is going off because you're having a low blood sugar and your blood sugar is at 62, okay, which is a low blood sugar. And you do a finger stick and your finger stick says it's 68, but that's still a low blood sugar, right?
Mm.
You're going to treat it with something really sugary, either some juice or some glucose tablets or, a teaspoon of sugar. That's what you're going to treat it with. But in 15 minutes, your finger stick will already identify that your blood sugar is going up because it's in the bloodstream that you're putting in the sugar that you're taking. But because this is in the interstitial fluids, it's going to take a little longer for this to really catch up.
That monitor will it will take like 20 or 30 minutes before.
Correct. Yeah, it'll lag. So it'll take it a little while. So never depend on this if it's alarming high or low. Depend on your finger stick machine, your glucometer.
Because
That
your
makes
sugar
sense?
because your sugar is really better through your blood, right?
It's more precise. Yeah, but none of us can do 20,000 finger sticks a day.
Yeah.
Most of us don't even want to do any finger sticks. In fact, most people that go on these monitors never want to go back to finger sticks, but unfortunately, we do have to do some finger sticks.
What is the normal about like how often should you be checking, or does it all depend on the person?
It depends on the therapy, the medication regimen you're on. It depends on your conversation with your educator or provider. Some people may only need to test once a day. Some people may need to test 3 times a day. Some people may need to test 4 to 6 times a day. If you're type 2, you're more likely to test less frequently. If you have type 1, you absolutely are testing probably 8 to 10 times a day if you're doing finger sticks. So this CGM technology is a godsend for softer, happier fingers.
Okay, does anybody else have any questions before?
I have another question I'd like to ask.
Okay,
Does
I
type
think this
2
is going to be the last question because to that, I know Marisol has to go somewhere and I appreciate her time. So I
Yeah,
think
it's
this
a
will be the
quick.
last question.
It's a quick one.
Okay.
Does type 2 diabetes have anything to do with your kidneys?
It can affect your kidney.
Well, type 2 can impact your kidneys. So what happens with any diabetes, whether you have type 1 or type 2, depending on how long you've had it, depending on how you've managed your blood sugars, people will have complications. And that is why education is also very important to try and either minimize those complications, prevent them, or delay them. And those complications, it can impact your kidneys, your heart, it can impact your nervous system, your circulation, your eyes. It impacts your gums. It impacts the entire body, really. It's in some way, shape, or form. Does that make sense?
It does.
Okay,
Thank you very
so if you
much.
have, oh, you're welcome. So if you
Yeah,
are
yeah,
being
we'll-
told that you're having some kidney issues,
I'll put this in.
then more than likely it's related to the amount of time you've had the diabetes, the type of diabetes you've had, and whether you have been the best that you can be with managing it.
I have a teeny quickie question. Can I just ask it real quick?
Well,
Sure,
Is
yeah,
sure,
well, I mean,
sure.
seriously, this is the last question. Thank you,
Okay,
Lynn.
is there, I have a quick question, like the quickest question. Is there sensors that like you can, because like the problem is like we're trying to get a sensor, but my insurance won't pay because they only will give them to you if you're on insulin.
Right.
Yes,
So
so
like what do I do? Like I frustrating. I'm
yes.
frustrated.
Okay, so I'll give you a few tips. So the first thing is that is no longer true for every insurance company. So I would call your insurance company.
Yeah, they
Because
denied me like 4 times already.
Okay, all right. So maybe yours is not one of those. But there is at least one insurance company that has now decided, I think it might be a Medicare Advantage plan. I'm not 100% sure. They've decided that they are going to approve and pay for a sensor. But if you want to use a sensor, because it really does give you a lot of information and it helps you become more autonomous with your management of your diabetes.
Yeah,
You
because the
can
problem is that I don't really know when they're going high, I don't have a pattern. I don't know.
Sure, sure. And I understand that. So you can actually go to your pharmacist. You will need a prescription for the sensor from your medical provider, but you can go to your pharmacist and you can ask for coupons. A lot of these companies have coupons, and you can probably get one of these sensors, probably definitely the Libre 3. They tend to have a lot of coupons for like probably anywhere from 75 to $100 a month. So
Mm,
this one here, okay? And again, you don't necessarily need to be monitoring your blood sugar 24/7
yeah.
going, but you can wear one a couple weeks in 1 month and maybe in a couple months wear another one for a couple of weeks, just so that it gives you enough information about, what is it that I'm eating that's increasing my blood sugars? Where is it 2 hours after I'm done eating?
Hmm.
And what adjustments do I need to make?
But the machine doesn't tell you like what you've eaten before they give you the numbers, right?
All
I'm
right, I'm sorry. I'm gonna have to cut her off because I don't, this conversation isn't just about Lynn. I'm sorry. And others, we did say that it was gonna last until 2, so I'm sorry.
Oh, it's okay.
I know that
Say
Marisol
1
has
to
to go, so
3.
I'm just gonna say thank you
Whatever.
very much to everybody. Thank you,
Just
Thank
to
you.
answer.
Marisol, for everything. I appreciate what your
Thank you.
conversations. Once Marisol sends me the information, I will forward it out to
Yep.
everybody.
I'll
So,
send it momentarily.
all right.
Yeah.
Thank you,
Yeah.
Thank you.
everybody.
Thank you
You're
very much.
welcome. Thank you.
Okay.
Okay.
Happy
Bye-bye.
Hanukkah.
Happy
Happy
Hanukkah.
Hanukkah. Bye.